Ever felt a random ache or unusual fatigue and just brushed it off? These signs could be your body's way of signaling something deeper. Let's dive into what our body is really trying to tell us. Our bodies are like finely tuned systems that often give early warning signs when something is off. Many symptoms we ignore or overlook could be red flags indicating potential health issues. This video will help you recognize and interpret these signs. First up, persistent fatigue. Occasional tiredness is normal, but persistent fatigue that doesn't improve with rest could signal underlying issues like anemia, thyroid disorders, sleep apnea, or even chronic fatigue syndrome. If fatigue is ongoing, it's worth checking with a healthcare provider. Chronic tiredness may be your body's way of saying it needs more than just rest. Next, frequent headaches. Headaches are often dismissed as stress-related, but frequent headaches can indicate dehydration, high blood pressure, vision issues, or even nutrient deficiencies like magnesium. Track headache patterns and assess lifestyle factors like hydration, diet, and screen time. If they're persistent or worsening, seek medical advice to rule out more serious causes. Next, digestive symptoms like bloating, constipation, or diarrhea can signal everything from food intolerances to irritable bowel syndrome, or even early signs of gastrointestinal disorders. Pay attention to symptoms, especially if they're recurrent. Keeping a food diary can help identify potential triggers, and a doctor can guide you through tests or adjustments to improve gut health. Next, skin changes. Skin is a visible reflection of our internal health. Persistent rashes, discoloration, or unusual growths could indicate autoimmune issues, nutritional deficiencies, or even signs of cancer. Notice any changes in moles, color, or texture. For anything unusual or persistent, it's wise to consult a dermatologist, as early detection can be key in addressing potential skin or systemic health issues. Next, sudden weight changes. Unexplained weight loss could suggest thyroid imbalances, diabetes, or gastrointestinal issues, while weight gain might indicate metabolic or hormonal changes. If you experience rapid or unintentional weight changes, tracking food and activity can be helpful. Seek medical advice, as these changes can sometimes signal underlying conditions that need attention. Next, constant thirst or frequent urination. Increased thirst and urination are classic signs of diabetes, but could also indicate dehydration, kidney issues, or infections. Ensure adequate hydration, but if symptoms persist, consult a doctor. Simple blood tests can check for glucose or kidney function to clarify potential causes. Next, shortness of breath or chest discomfort. Often dismissed as anxiety, recurring breathlessness or chest discomfort could be early signs of respiratory issues, cardiovascular disease, or even acid reflux. If these symptoms are frequent, especially with exertion, seek medical evaluation to rule out more serious issues. Heart and lung health assessments can reveal underlying causes that may need attention. Next, muscle cramps or tingling. Frequent muscle cramps or tingling sensations may indicate nutrient deficiencies, such as low magnesium, calcium, or potassium levels. It could also suggest issues with nerve health or circulation. Evaluate your diet to ensure you're getting enough of these essential minerals and stay hydrated. If cramps or tingling are persistent, consult a healthcare provider to check for deficiencies or potential nerve conditions. Next, hair loss or brittle nails. Thinning hair or brittle nails can be a sign of nutritional deficiencies, thyroid disorders, or high stress levels. Conditions like iron deficiency anemia and hypothyroidism are common culprits. If you notice these changes, consider a blood test to check for thyroid function and nutrient levels. Maintaining a balanced diet, rich in vitamins and minerals, can also help. Next, persistent cough or hoarseness. A lingering cough or hoarseness beyond a couple of weeks may indicate more than just a simple cold. It could signal respiratory issues, acid reflux, or, in rare cases, early signs of throat or lung conditions. Keep track of symptoms and any patterns, like worsening with certain foods or at night. If symptoms don't improve after a few weeks, seek medical evaluation for a more thorough assessment. Next, changes in urine color or odor. Dark, cloudy, or strong-smelling urine may be a sign of dehydration, kidney issues, or urinary tract infections. Blood in the urine is a particularly serious symptom that should be checked immediately. Ensure adequate hydration and monitor urine changes. Persistent or unusual changes warrant a doctor's visit, as kidney function tests or urinalysis may be needed. Next, difficulty swallowing or persistent sore throat. Trouble swallowing or a long-lasting sore throat may indicate acid reflux, thyroid issues, or even early signs of esophageal problems. Persistent sore throats can also be a sign of chronic infections. If symptoms are frequent or worsening, consider a medical checkup, as these issues may require treatment or lifestyle adjustments, especially if related to acid reflux or infection. Lastly, irregular or rapid heartbeat. Occasional palpitations can happen due to stress or caffeine, but frequent irregular heartbeats or rapid heart rate might suggest electrolyte imbalances, anemia, or underlying heart conditions. Track any noticeable changes in your heartbeat. If they're persistent, seek medical advice, as this could involve simple lifestyle adjustments or, in some cases, further cardiac evaluation. Remember, paying attention to these signs can make a big difference in maintaining your health. Stay informed, stay healthy,